Hi, this is Dr. Singh from Las Vegas. I'm an internal medicine physician, also a nephrologist. I practice at HEALOR in Las Vegas and also at Rare Med Spa, where I'm the medical director. So the topic of discussion today is premature ejaculation. Such a common sexual issue that we see in our sexual health clinic in Las Vegas at HEALOR affects men worldwide. So it happens when a male ejaculates sooner than he or his partner would like during sexual activity. Can cause a lot of problems with self-esteem, relationships. So many options available to treat it. So to manage it, we're going to go over those. So what is premature ejaculation? So in order to understand, we have to understand the sexual process. We have to understand the process of ejaculation. So basically, ejaculation is you have a pleasure, culmination, series of physiological processes, and this is all orchestrated by the nervous system. And it results from physical stimulation during sexual activity and also psychological stimulation. So there are two phases to remember. One is the emission phase, the other is the expulsion phase. So the first phase is the emission phase. So during emission phase, we're basically building this fluid, the seminal fluid, which is produced by the seminal vesicles, the prostatic tissue, a lot of sperms in this fluid, some other components. So it travels through the vas into the urethra. And now, because the fluid is traveling upstream, so there is this buildup of this pressure in the urethra. And men can feel it, that there is a pressure building up. The expulsion is the second phase. So now you have contractions of the pelvic muscles. And this is basically expelling these contents of the seminal fluid and the sperm out through the penis in a series of spurts. So you'll see pulsating activity, basically. And this marks the climax phase, right? When somebody has premature ejaculation, so this delicate balance is disrupted. So ejaculation is happening earlier than what we desire. It can happen as early as just initiating sexual activity, even before penetration. It can cause a lot of frustration, a lot of anxiety, a lot of dissatisfaction with sexual experience, and many men will start avoiding sex because they feel like they will get embarrassed and they don't want to do it, which is problematic and cause more psychological issues over time, right? So premature ejaculation can happen to anybody, right? But it becomes a problem when this is happening more frequently and on a regular intervals. So that's when it becomes something that we need to address and treat. So there are two types of premature ejaculation. One is lifelong. So lifelong is where it's been present since the first sexual experience. Can be linked to genetics. Could be a hypersensitivity of the ejaculated reflex. There can be psychological issues at play here. The second type is the acquired one. So this happens later in life. So that means the individual could have normal sexual experience, normal sexual function for a couple of years, and then out of nowhere, now they can't control their reflex and they have premature ejaculation. Could be caused by stress, and relationship issues are common. Lack of attraction to the other partner sometimes, changes in sexual habits. There are multiple things that can cause acquired premature ejaculation. So there are a few factors that we do understand that contribute to this. So the most important one is the neurotransmitter imbalance. Serotonin is a key factor here. So serotonin the neurotransmitter is involved in mood regulation, and it controls our impulses. It's produced in the gut by bacteria. Some of it is also produced in the brain, and then it travels to the blood-brain barrier. So if individual with premature ejaculation have low levels of serotonin, so that leads to an enhanced response when serotonin levels spike up, right, during a climax, and that causes the premature ejaculation. Hypersensitivity is the second issue, right? So some men can just have increased sensitivity of these penile nerves, and it can cause an overactive reflex, kind of like an overactive bladder, where men can have overactive bladder and they have urinary incontinence because the bladder is constantly contracting. So same issue can happen with the ejaculated reflex. It can cause increase in incidence of premature ejaculation. Apologies. The third part is the performance anxiety, right? So common psychological factors. So performance anxiety can lead to premature ejaculation, and premature ejaculation problems can cause performance anxiety. So men can have this fear that I'm not going to be able to satisfy my partner, and this can cause problems with arousal and can trigger early ejaculation. Stress, any type of stress, a lot of stress, anxiety, tension could be related to work, could be related to relationship, other aspects of life. Because the stress hormones, the cortisol, it affects our body's ability to relax. So our sympathetic nervous system triggers in, our heart rate goes up, we're sweaty, we're nervous, and we can't just control our emotions and our reflexes when we're under extreme stress. Age, so it can happen at any age, but we do see these problems more in younger men. And with age, as the sensation of the penile nerves goes down, the reflexes become weaker, the pelvic muscles become weaker. We see this gets better with time. So when somebody has premature ejaculation, it can cause a lot of problems, right? The main one is decreased sexual satisfaction. So sex is such important for mental health, so when individuals have premature ejaculation can lead to frustration and dissatisfaction from both partners. Affects the quality of life, affects the marriage, affects the relationships. So it can cause communication problems because men don't want to communicate this. They are embarrassed about it. Self-esteem problems can kind of kick in, feelings of inadequacy, shame, embarrassment, and which can cause psychological problems. So main thing to how we treat it, right? So that's the next one, right? So we can do at our sexual health clinic. So we talk about psychological therapy. There's behavioral therapies that can be used. So the whole idea is to give this man a sense of control. So we can do cognitive behavioral therapy. There is sex therapy, right? So some of the techniques we teach could be the stop and start technique. So where you just start urinating and then the man has to stop midstream, and then you start again, and then you stop again. So you're sort of training yourself to control, right? So we're developing that control factor. The second is a squeeze. So just before ejaculation, you have to squeeze so that pelvic muscles get squeezed together, and then again that can delay the premature ejaculation. Certain medications we use would be SSRIs, fluoxetine, for example. So these medications, they raise serotonin levels in the brain. So now when the climax happens, the serotonin level is not going high enough in the brain, so which can delay ejaculation, which is very effective. The problem with these medications is that they also limit sexual activity, and it can, men have reported that once I started taking this, I absolutely have no sex drive, don't even feel like masturbating. So that can create problems as well. The other things we like to use is the numbing cream. It can be lidocaine cream, can be benzocaine cream. I personally prefer using lidocaine spray in our office because it's easy to apply, it's easy to clean. So this works by desensitizing the penile nerves, and then men can maintain erections for much longer. One thing to remember is that when the lidocaine spray is applied, or lidocaine cream, before penetration, this should be removed, because otherwise it can also numb the genitalia of the other other partner, and then they will not have any sensation whatsoever. So that's one thing to remember when using numbing creams, such as lidocaine. So that's all on the video of premature ejaculation. So remember, guys, it can happen to anybody. It is absolutely manageable. It's absolutely treatable. Communication is key, and seeking help is key. So I hope you like this video. If you did, please don't forget to like and subscribe. And I'll see you soon.